Now, Cosatu says it's unhappy at government. The Union Federation is accusing government of mismanaging the vaccine rollout program. Is Cosatu going to do anything about this? Well, the parliamentary coordinator, Matthew Parks, is joining us this lunchtime. Matthew, good afternoon. Thank you very much for your time this lunchtime. Yeah, I've seen the statement that Cosatu has issued. You really don't mince your words about how you're feeling about the slowness of the vaccine rollout. But the question is, can you do anything about it to try and make sure that the government accelerates this program?
No, thanks. In fact, we were being diplomatic, to be honest. We can't be soft or mollycoddling mediocrity, not when lives are at stake. The death rate now is quite mercifully low, at 50, 100 a day. But when the anticipated third wave comes, you might find the death rate, like in December, skyrockets to 1,000, 800, 700 a day. So I think for us, really, government is blundering the vaccine rollout program. We don't want to hear speeches or platitudes or promises. We are a third of the way through the year, and to date, we've vaccinated less than 200,000 people in the country, even failing to meet government's own very timid vaccine target timeframes. And now we saw in the past weekend, the Minister of Health, Dr. Mkhize, talked about pushing back those dates even further. So I think for us it's quite worrying. Look, Cosatu is not government. We don't control the state. All we can do is to raise the concerns of our members.
Can you put pressure? But can you put pressure through your members? I mean, I think one of the largest public service unions, NEHAU, is one of your affiliates.
Yes, so that's in fact what we've been doing. We've been putting pressure on government through NEDLAC. We meet with them weekly on the vaccine program, on the many modalities of it, through the alliance, through Parliament, and directly with government and the President himself. We will continue to put that pressure until every single person who needs to receive a vaccine, the 70% immunity target, receives it. I think this is going to be a long process, but to be honest, government has to do much better. And the rationales, the excuses that government has given are frankly unacceptable and not convincing. We were told that, well, the industrialized countries have moved with speed, but we're seeing other African countries like Morocco and Egypt and even Seychelles moving very fast, and yet we are still scrambling around looking for the starting point. Now,
yesterday the President inspecting the Johnson & Johnson facility, the Aspen facility in Gqeberha, that's going to be producing the Johnson & Johnson vaccines, and promising that from next month, April, which is just around the corner now, the whole process is going to be speeded up, and they're going to catch up on lost time. That's what he said, that the momentum is going to pick up. Did that help to change your view of what's been happening?
Look, it's positive that Aspen has got the contract to manufacture about 300 million dosages for Johnson & Johnson. That's a huge boost. But again, these engagements with Aspen, with other countries, other providers, should have been done between September and December last year. We are dealing with a government who's now trying to play catch-up for time for having missed the boat. But look, we do want to see government succeed. We need to get these vaccines rolled out. We need to get as many people, in particular the health workers, the elderly, the people with comorbidities, other essential workers vaccinated as quickly as possible. Our nurses and doctors who are members of Cosatu have been very keen to play their role to help ensure success. But we need to see government moving with much greater speed. Because even the April deadline, we were told by the Minister of Health on the weekend in the media that actually might only happen in May. So we see a continuous pushing back of the deadlines all the time. And this doesn't even take into account the likely logistical glitches you will experience when engaging in a mass distribution program, which speaks to vaccinating about 200,000 people every single day. But I think for us, we hope it will happen. We can't afford for it not to happen. But honestly, government has to do much better. This kind of level of mediocrity and dilly-dallying doesn't help. We see continuous articles in the media saying that, well, some of the pharmaceutical companies are waiting for government to pay the money. We should not even be having this kind of conversation, because the cost of the vaccines is a fraction of the cost that the economy, the workers have incurred during the lockdowns and during the economic crisis.
Yeah, just as we conclude, Matthew, do you think it's been a lack of leadership, or political will? What do you ascribe this slowness by government to?
Look, I think we've seen over many years, over the last decade, a significant decrease in government leadership capacity at a politician's level, at an official's level. We're paying the consequence of the decapacitation of the state. we can give no other rational explanation to it. We cannot blame the issue of finances because the finances are a fraction of the cost the economy is incurring or the UF has paid out. We can't say it's not a priority because people's lives are at stake. Yeah. All we can say is that this is incompetence at a tragic scale and people are going to pay the consequence in lives lost which should not have been lost.
Okay, thank you very much, Matthew Parks there from Trade Union Federation. He's a parliamentary coordinator of Cosatu.